Is this on? Yes, good. All right. Hi, everyone. My name is Carol Hammal, also known as Carol Hammal in the States. I am here to introduce to you this wonderful field, an intriguing field of art therapy. We're also going to talk about its potential for growth in Egypt. So I'm going to start with a little story. What got me into art therapy in the first place? So I was an undergrad at the American University in Cairo, studying computer science. And after about a year or so, I realized that this really wasn't for me. I wasn't fulfilled. I didn't feel the passion for it, even though I was really good at it. But it just wasn't me. So I shifted from computer science to art, visual art. And when I did so, our work involved a lot of art projects, almost on a daily basis. Thank you. And with our projects, we always worked with a concept. And my way was always having a concept in mind and being very intentional about what I do, until this incident happened. So here I am one night, and I feel really upset. I just grabbed that pad of paper and a piece of charcoal, and I went very randomly with just strokes on paper, and no intention whatsoever, shape, form, object, concept, nothing. And this happened. So we have the next. So you get to see that. It's a fully proportional yet abstract face. You can see the eyes, the nose, everything. No intention there. So I didn't understand, and I took it to my professor the next day, and I told her, explain this. I don't know what that is. And she looked at me and smiled, and she's like, you know what? What you just did is a form of art therapy to yourself. And I was like, what the heck is art therapy? So she said, go to the library, read about it. You know, at AUC, they don't feed you things by the spoon. You really have to look for it yourself. So I went to the library and read about art therapy. See, I was always fascinated by the link between art and psychology as an artist. And I always had that unexplained talent of being able to tell who you were from your artwork. Even your doodles, I can always say, you're 1, 2, 3. But that was just a skill. And when I read about art therapy, I realized that there was someone that did link psychology to art. And it's called art therapy. And the woman responsible for that is called Margaret Nomberg. We can see her picture right up here, coming up. So she is the mother of art therapy. She was the first person to acknowledge art therapy as a profession. That was back in the 1940s. But it wasn't really until this lady, Myra Levesque, introduced the first art therapy graduate program in the whole world. And that was in Philadelphia in 1967. I was very honored and very happy to be able, this is actually where I went to study, Drexel University in Philadelphia. So they created the first graduate program, and a couple of years later, they introduced the American Art Therapy Association. It was founded, and its main purpose was to group and unite all art therapy professionals, and also set the educational guidelines for each program and approve them to have an equal standard of education to train art therapists. So going back to school, my story that I was telling earlier. After I finished my bachelor's degree in visual art, guess where I ended up working? What field? Can you guess? Anyone? You wish. I went back to IT, of course. So here I am. I left computer science to go to art and then go to IT again. I ended up working for multinational companies that was specialized in very fancy home automation systems, and ended up being hired by Apple in Egypt as their development manager. Very high IT technical work. And I realized I came back to square one. I wasn't fulfilled. I wasn't happy. I had that talent, and I loved art therapy so much. So what was I doing? Why am I here? So if I loved art, I realized that if I really loved art therapy and I want it, then I should go for it. What was I doing? So I decided, okay, I quit my job. If I want art therapy, I should reach my potential. I applied to Drexel University for my master's in art therapy, left my country for about a little over 2 years, and went to pursue my degree. So this is leading us, thank you. Thank you. Thank you. It leads us to the main aspect of this talk today. What is art therapy? Most importantly, though, what is not art therapy? Art therapy is not an art activity in which people just draw and paint and feel better. Though this open studio format is sometimes used in art therapy. We use that sometimes. It just depends with whom, and we'll talk about that. So you have here the official definition of art therapy by the American Art Therapy Association. Art therapy is actually a lot more than just making art. It is a clinical field. It's a health profession. It falls under the umbrella of healthcare. And its main goal is to achieve insight through the creative process that takes place. Through that mode of self-expression, you get to get a higher self-esteem, resolve your conflicts, and gain a lot more insight. Again, we can go refer always to that definition over here. Now, we said it's a health profession, but it falls typically under the larger field of what we call creative arts therapies. Such examples on the list coming up is dance movement therapy, music therapy, play therapy, and many others. So art therapy here, when we say art, we're really focusing on visual art, painting, sculpting, drawing, that sort of thing. So as we go through from here, let's take a little deeper look. And I'm going to do this instead of focusing on so much theory. I'm going to give you like a typical sample session that will go in a little further. Now, when we practice art therapy, we use two major components or approaches. One is called art as therapy, like the one on the left. We have art as therapy on the left, art psychotherapy on the right. And they're two very different approaches. The first one, art as therapy, is informal, more like an open studio-like format. And we really focus on giving you the chance to make as much art and end up with a final art product that's coherent. And sometimes the art therapist can even intervene to help you achieve a nice artistic result. On the other hand, art psychotherapy on the right, and you can see it has a lot more components involved, is a psychodynamic approach. It's much more clinical, and we spend less time maybe on the artwork, but it always involves two things, art making and the verbal process. And through the verbal process, we get to use the patient's or the client's associations and the client's interpretation and analysis of the artwork. And we don't really focus on having an art product that's finished. We aim more for the process itself, the creative process itself that's taking place for us to achieve that insight. Now, let me give you a sample, a typical session that we do in art therapy. So let's go back to the previous slide. As you can see here, we have the clock. And in therapy, we typically have a session that is an hour, but it's a 50-minute hour. So within the 50 minutes with art psychotherapy, I'll administer a task. And it's usually specific, but with very vague directives to allow the client to express themselves without much influence from the therapist. So we'll administer something like, draw yourself as a tree, for example. And we'll give some time to the client, about 10 to 20 minutes to do that. And then we start the verbal process. And I would start that by asking open-ended questions. Something like, why does this tree look like you? Why does it represent you? They can answer something like, for example, well, I'm a very nurturing person, so that tree has a lot of apples in it. It's a very giving tree. See, and if we go back and forth and a conversation starts, and that leads to helping the patient to gain more insight about what they're doing and what they created over there. And like we said, we don't necessarily need an art product. Now, if we went to art as therapy, we would do the same thing. Draw yourself as a tree. But we're going to give them more time to do that. And we're going to really focus on having a finished piece. So far, this is what we've had in Egypt. We didn't really have art psychotherapy in Egypt yet. And this is the part that people need training for. So you see, the trick here with art psychotherapy is that art making automatically decreases your defenses. It automatically opens things up. You externalize your thoughts and your feelings through that creative process and express yourself on that piece. So what we've done is that you put out your unconscious mind on that piece of paper. That piece of paper becomes a representation of your unconscious. So what we did with art therapy is that we made the unconscious conscious. And through that process is how you start gaining insight about yourself, and we start resolving conflicts, always using the symbolic reference in the artwork. And as we see, the diagram is pretty useful to show us how we do that. All right. So those two different techniques are used in art therapy. It depends what case I'm working with, who am I working with, to use which approach. That leads me to this question. Who is art therapy for? Who do we practice art therapy with? Back in the definition, we saw that it told us we practice it with adults as much as we do with older adults and children. But see, people have this perception that art therapy belongs in an art studio. But that's not true. Art therapy is actually a lot more successful when it's implemented in clinical settings, for example, like hospitals or nursing homes or outpatient centers. It is also very useful when we implement it in educational settings, like schools. So we can actually apply art therapy in a way that gives us a lot more room to do things here, which leads me to something even more interesting. Specialties within the field of art therapy. When you go get trained, you can even get trained to the point of specializing in very specific areas in art therapy. For example, doing art therapy in educational settings, schools, either general schools or specific schools like the ones aimed at children with special needs or children with learning disabilities. There's also a branch of art therapy called medical art therapy. You can guess from the term, we work with medical cases in hospitals. And we don't really cure their disease. We're aiming at helping them through the mental aspect of dealing with their disease. And actually that leads me to my own specialty. My own specialty is doing art therapy for pain management, for geriatrics, and end of life. And then the final branch that I find very interesting, I think you will too, is called forensic art therapy. Now, forensic art therapy is mainly used in court. So we can actually go as far as having art therapists as experts in a court case and use the artwork that was created in a session as evidence to be used in court. Such an example, for example, is when we have a child in a child abuse case. You can use the child's artwork as evidence in court to help with the ruling. So this is all a lot of theories. I'm sure you're getting a lot more confused by now. So let me give you an example of how we work with a patient. I'm going to give you a patient example. And we're going to use that similar diagram here. So I had this patient at the hospital who suffered from OCD. OCD stands for obsessive compulsive disorder. Such people typically suffer from obsessions and obsessive thoughts, and it's very hard for us to convince them to do otherwise. They're compulsed to do that. And such thoughts could be like hygiene. They can be over-obsessive about cleaning and cleaning. They can be obsessed about order. And this client actually had a chief complaint in which she was really obsessive about hygiene. And she used to spend so much time to clean and over-clean her house because she was convinced that her house was filled with germs. Even her family members were sources of germs. And so she would really obsess about that. And all attempts and treatment at the hospitals had failed. So I was asked to intervene. And what I did is administer an art therapy assessment in the first sessions, which is what we typically do in first sessions. This is actually one of the advantages when we compare art therapy to other creative arts therapies. Art therapy is the only one that has standardized assessments, well-researched assessments, that gives us so much information on first hand that we can use in following sessions. So I provided an assessment, and based on that, I was actually capable afterwards to identify certain issues that she's had. And my intervention in that case was to give her clay as an art material. Now, if some of you are familiar with OCD, clay would be a serious problem for people like them. Why? Well, they would have a lot of residues in their fingers and nails, and that for them, with someone who is obsessed with hygiene, would be a huge problem. So I've used a modified type of clay, which leaves 0 residues, and it's very light. And I open a fresh pack right in front of her to comfort her as much as possible. She reluctantly accepted to use it, but we had established trust in the session, and so she trusted me enough to try. She ended up representing her house. She made a house, which represented her house. That was a source of germ. But she realized that using that clay wasn't so bad after all. And she said, that house looks a lot cleaner than mine. I like it better. And she was amazed that she ended up using clay, which for her would have been a nightmare. And see, what happened here is, like we said, we acted out. We reflected her unconscious thoughts. She acted out her fear through the art process, which symbolizes her fears in real life. So it's almost like replicating her real life through the art. And that's the trick here. Doing that with verbal therapy would be very tricky. And she wouldn't have figured that out without the art component here. It was through the artwork that she was able to overcome the fear. And after being secluded in her room for over a week before I started seeing her, she finally went out. She attended groups. She attended other forms of therapies and engaged with other patients at the hospital. So, thank you. All right, now we're here in Egypt. I am here in Egypt. And like I said, I did leave my country behind and went to pursue my degree, but I knew from the very beginning that I wanted to come back here and bring art therapy home. So where does Egypt stand in all of this? You see, Egypt has a huge stigma about therapy. And I find that to be an advantage and a disadvantage at the same time. By stigma, we mean that people don't feel comfortable to go speak to a stranger, the therapist, and talk about their problems and express themselves. It is the nature of our culture. We're a very oppressed society. We do not feel comfortable to talk about our issues and divulge information. But you see, with art therapy, it's different. You don't need to talk if you don't want to. You just come in, you create some art, and because, like we mentioned earlier, art breaks down your defenses, and it opens things up, and it allows your unconscious to come out, you will at least want to tell me what you drew. And that starts a conversation and leads to therapy. So I believe that this dynamic here is very useful and makes art therapy a lot more successful in Egypt compared to the West, just because our stigma is higher compared to other countries. So why am I here? I said when I left that I wanted to bring art therapy home. And by that, I mean having art therapy that is based on proper clinical and academic guidelines. The same standard that other countries have. So you see here, my goal here is to establish the first art therapy graduate program in North Africa and Egypt. And with that, I can't tell you how many people have approached me in my workshops asking to pursue their degree in art therapy. But we have none of them here. To do that, you have to do what I did. Leave your country behind, live for 2 years or maybe more, and come back. So not everyone can actually afford doing that mentally, physically, or financially. We deserve, Egyptians, passionate Egyptians, deserve this chance. I was given this beautiful gift of high education, that makes me do what I do best. You deserve it too. Egyptians deserve that too, locally, here in Egypt. So I will just close with just saying that Egypt truly deserves art therapy. Thank you so much for listening. Thank you for coming tonight. Appreciate it. Thank you very much.